Health Talk, brought to you by Rapides Regional Medical Center. It's mosquito season in Louisiana, which means it's also the season for West Nile virus. More and more cases of West Nile are being reported in Louisiana, which is annually among the states hardest hit by West Nile. Although there were just 54 reported cases in 2013, there were more than 335 in Louisiana in 2012.
West Nile virus is a virus that you get from a mosquito bite. The mosquito bites an infected bird and then can pass the virus on to you. It's not a virus that can spread from person to person. It does require the bite of a mosquito, but both humans and animals can get it.
Unfortunately, the West Nile virus can be fatal, as 20 people have died in Louisiana in the past 2 years.
About 20% of people that get it will have just a very mild case of it. That'll be flu-like symptoms such as headaches, fever, body aches, and it typically lasts a couple of weeks and then goes away. If you have high fevers or changes in the way you're thinking or anything that looks scary, go ahead and go to the emergency room. If you're having flu-like symptoms or headaches and are not all that ill but want to make sure about it, then come to your family physician and we can do a test to check for it.
Mosquitoes are a way of life in Louisiana, which is full of swamps, rivers, lakes, and wooded areas. And Rapides Parish had one of the highest incidence rates of West Nile in the United States in 2013, according to the Centers for Disease Control. There are ways to protect yourself, though.
You should always wear a mosquito repellent that contains DEET. You should always dress with long sleeves and long pants on if you're going to be in a mosquito-ridden area. Make sure to drain any standing water and avoid going outside during dawn and dusk, which is when the mosquitoes typically are at their worst around here.
For more information, visit rapidesregional.com.